Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on eczema. I will discuss eczema flares and what you can do to prevent them or treat them if necessary. So if you're ready, let's get started with a dose of medical inspiration. Skin infections, temperature, and climate can also lead to skin flares. Other things that can lead to flares are not using enough moisturizer after a bath. Now, make sure that you use a cream and choose one that does not contain perfume. I personally recommend something like a Eucerin or perhaps Aveeno eczema cream, or even Aquaphor is quite good. Now, some of my dermatologist friends also recommend just using plain old Crisco. Yeah, Crisco. Now, if you're going to do that, get the plain, not the butter flavor, plain. But you should ask your doctor for his or her advice. All right, the other thing to think about, with moisturizing, there's a very important key thing. This should be done immediately after your bath, before you dry off. What you want to do is shut the water off, step out of the shower, don't grab the towel. Grab the Eucerin or Aveeno cream or whatever you're using. Grab that cream, step onto the bath mat, and apply the cream while you're still wet. Then grab the towel and gently pat the skin. Don't rub yourself dry. Gently pat after applying the moisturizer. This will help by trapping moisture into your skin. It works fantastic. Definitely you want to do this, okay? Another thing that can cause an eczema flare is low humidity. This is particularly worrisome or bothersome in winter. So make sure you don't forget that moisturizer after each bath, especially in winter. And one other thing, unless you're a manual laborer, you may not need to take a bath every day. Particularly, you want to keep this in mind if it's your baby or your child that's suffering from the eczema. Daily bathing makes this condition a lot worse. So consider just sponge bathing certain cracks and crevices daily. And maybe they only need to take a bath 2 or 3 times a week. This will probably really help their eczema improve. Some other things that cause eczema flares are dry year-round climates. Again, I hate to beat a dead horse, but remember that moisturizing your skin regularly is really important. All right, other things. Long or hot baths and showers, these can cause flares. So take short showers at moderate temperature, and your water and energy bill will probably improve as well. Now, going from sweating to being chilled can cause a flare, so try to avoid excessive sweating. If it can't be avoided, don't let the sweat sit on your skin. Take a short shower with soap, and don't forget to moisturize while you're still wet. The optimal goal if you have eczema is prevention, prevention, prevention. You can really make your life better by avoiding flare-ups if you will try and do these things that we've just talked about. Unfortunately, even if we do our best, sometimes flare-ups still can and will occur. So if they do, let's talk a bit about treatment options, shall we? Once inflammation begins, prompt treatment as directed by your physician is needed. Bathing or wet compresses may ease the itch, but just remember to moisturize with a nice cream while you're still wet. Now, the main traditional medical treatment for eczema remains steroids. Cortisone or steroid creams applied directly to the affected area are helpful and a mainstay of therapy. Keep in mind, however, that overuse of highly potent steroids can be damaging. Steroid pills like prednisone or shots like Kenalog or Solumedrol are sometimes used. But again, we have to be aware that many of these agents have side effects, particularly if used for long periods of time. If these treatments don't help, your doctor may send you to see a dermatologist who has newer medications that they may use, and of course the scientists and researchers continue to seek newer and safer drugs to control the itch and inflammation. Another treatment option to mention before I let you go is the use of ultraviolet light or sun lamps. Under a physician's supervision, some eczema sufferers find relief with these treatments. Tar baths, antihistamines, and antibiotics are often used depending on the patient and the circumstances. We'll not talk much today about alternative treatments, but there are also vitamins, mineral supplements, enriched diets, and nutritional supplements which may be recommended. Now, while most of these don't have as many of the scientific studies that we doctors like to see to be certain that there's evidence to prove that the treatments help, I personally feel that some of this is worth a try. And if it works for you or your child, and if it's safe, then I say keep using it. In our particular case, my girls have had good luck with an anti-inflammatory supplement, I guess you would say, and they've done quite well on that. So I guess what we've talked about today is everything you ever wanted to know about eczema. I'm Dr. Sugar, and if you haven't already done so, be sure to watch all of the medical inspiration videos on eczema. Thank you for joining us. Check out the video content library for many other medical videos on a wide variety of topics, and I'll see you there.